Hi everyone, this is Nancy from Education. I am going to do a brief review of how to appropriately use the Addie's Vial adapter from Braun with our new mini bags so that we can reduce the risk of medication waste and get everybody comfortable with the use of the device. So as you notice, we have 3 different size devices. The blue one is appropriate for a 13 millimeter top, similar to this, which is a smaller vial, and it is designed specifically for this size vial. And this blue vial adapter is only appropriate to attach to the 100 cc bag or the 100 ml bag of Braun diluent, and that is based on the design of the bottom of the bag. So the blue Addie's Vial adapter only goes on a 50 or the 100 ml vial. The same can be said for the green Addie's Vial adapter. So this one is actually appropriate for the use with a 20 millimeter top vial, so a larger vial, more commonly used. The smaller one will predominantly be used in the ED or the ICU setting, versus the 20 millimeter size you'll see on most of your common antibiotics that you're using. So the 20 millimeter vial goes to the green adapter, and again, it is for use with the 50 and the 100 ml size bags that we carry. And as we move up, we'll see the white adapter. So this Addie's Vial adapter, similarly, it will fit with that 20 millimeter top on your vials for most medications that we actually use these for. However, it is only designed to go on the 250 ml size bag. And what you'll note is the bottom design of this 250 bag is different, and in a moment I'll help you understand why that is the case. So if we're going to start with we'll choose a green as a demonstration of how to appropriately put these 2 pieces together and add them to a bag so you can mix your medicines appropriately. So obviously when you take the top off, you want to have the medication vial flat on a surface, because the goal is that you go downward into the center of this plunger with the injector. So you see the big spike in the center of this, and the green one, it is plastic, but you're going to want to center that on the center of this plunger. Make sure you have a good firm hold of it, and then just push it forward. All of these flanges will actually grasp on the side of this vial and make it secure, which will then allow you to twist off in a counterclockwise motion the top of this green. There's a needle in here. It's a small needle that's protected by the bevel of this U-shape. This is actually, they'll call it like a saddle that will go on to your bag. Important to note, the end of these bags, the one with the extension with the silver on it, this is where your IV tubing is going to go, not where your medication is going to go. Where you have the blue plastic cover, that's where your meds are going to go. So if for some reason you accidentally use your Addie's Vial adapter and you poke through the silver foil on here, you want to discard the bag, because now you've violated the integrity of the bag. So and it's not meant to be through that port. So we'll pop off the blue here. The recommendation from the manufacturer is that you actually lay this down and do this in a flat motion to help you actually have the pressure behind connecting the bag. Also, as you see, this will only fit one way, so you have to have it properly aligned, flat on a surface, and just add a little pressure, and then you'll hear it click into the bag. Remember, these bags are a little bit more rigid than the bags we're used to previously using, so you have to fold down, apply a little bit of pressure, which will then force your diluent into your medication. And then once you have that and you stir it up and dilute it so everything's dissolved in there, you would flip it upside down and use a counter squeeze just like you're used to doing, and get the medication back into the bag. So you want to ensure all the medication is out of the vial in the bag prior to actually hanging this medicine, so that the patient gets the full benefit of the whole dose. Okay, so we're also going to talk about the white vial adapter. So this larger one is designed, as I said, only for the 250 ml size bag, and that's based on the bottom down here. So the length of the port that it actually goes into is longer. It's also more rigid, which will reduce the risk of you actually going through the sidewall of it. So again, this white one would not be used on a 100 or a 50 ml bag, only on a 250 ml bag. So same process for how you're going to actually put these together. So the plastic introducer through the center, your med's on a flat surface, you push it down, it clamps around, and then you're able to counterclockwise turn this off. What you will notice here, the saddle is much larger, and this needle is actually visible, so you want to be careful. So with this, so on the bottom of this bag, same thing, the rigid port with this cap, this is meant for your IV tubing, and it's the rubber stopper side that is meant for your medication vial to be added to it. You're going to lay it on a flat surface, control the port of entry, get your needle on the center of that rubber stopper, and you're going to have to add some pressure to kind of get that to go through, so that you can actually get it, and you'll see where it's coming up along the side of this bag, right? So once it's in there, this is also like a harder plastic to help you guide it through there. So same process, you're going to squeeze down on the bag to get the fluid to go in so you can mix your med. Once you dissolve your meds, you're going to put the med back in there, then spike your IV tubing so you can actually hang your medication and treat your patient. So one thing I did want to show you an example of was the improper use of the Eddie's vial adapter. What happens? So in this case, what you can see is we actually used a white top vial adapter on a 100 bag, and it didn't work out very well. What happened was the needle, I don't know if you can see this, actually sidewalled here and went through the bag. This is because this Addie's vial adapter is not meant for the 100 or the 50 ml bag. This is why it's important for us to always choose the right size adapter and the right size bag. So I hope this helps. Good luck with your future IVs and starting meds and mixing using the Addie's vial adapter. Have a great day.